on a couple of yours. Jackie, too.
Okay, so we're all here. Why don't we get started? Jeff, if you don't mind doing the minutes,
Absolutely.
that'd be great. We'll open the meeting at 7:10. And just as a reminder that the email I got too about doing these Zoom meetings is that, you know, as soon as you sign on or go on, the meeting's being recorded. So just FYI, even though the host hasn't necessarily gone on to claim it as a meeting, if you've logged on, it's recording. So I guess the advice is don't log on until it's like right before the meeting, before the meeting. Otherwise, you'll be recording in your home, and you know, you may not want to have that on public display. And then also, as Catherine pointed out, any vote that's taken has to be done by roll call vote. So I'll just go through the roster when there's a vote to be taken by the trustees. All right. So with that, can I get a motion to accept the secretary's report?
So moved.
So moved.
Oh,
And a second?
second.
Second.
Second. Okay, by Chris. All right, discussion.
Just, Kevin, I just have a question. Did you go to the planning board?
I did.
Yes.
And that worked out okay?
Yeah, I mean, it was, they had only one person who participated in the call, and I forget the woman's name now. But it was a woman
Was it
who lived
Bronwyn?
on Crestview. Is it Crestview?
She lives on Chestnut Street, so
Chestnut Street, sorry, Chestnut Street.
yeah, and she was just interested in the topic, and she was fine with the answers. So
Yeah.
um,
It was a little unusual,
Maybe
but
'cause she-
in the sense that the planning board asked, you know, myself to kind of just, you know, talk about what happened at the meeting. I just went over it briefly. That was it. And then they went on to discuss it. And then the planning board asked for any questions. And the woman asked a question to me, like, what did the library board, why did they think it was, you know, I forget her exact question. Why do you think it was good for the library? I thought it was unusual that she would ask me that question rather than, because it was a planning board meeting. And I thought that, you know, if she wanted to ask that question, she should have come to our meeting to ask that question. But she asked the planning board, but I answered it, you know, basically told her what a summary of what we discussed, and that was it. It was kind of quick and easy. And the board voted, and board voted in favor.
Okay.
Of it, and kind of moved on from there.
yeah.
Okay, thanks.
All right. Yep. Anything else on the secretary's report? Okay, so we'll do a
Yeah,
roll call vote.
Kevin? Yeah, Kevin,
Chris,
am I mute?
just say aye. I'll go through the thing. I'll go Chris.
Cindy?
Aye.
No, there's a
Cindy's trying to
Kevin.
say something,
Kevin,
Kevin. Can you hear her?
Cindy,
Oh,
no, I
Cindy's
don't
asking
asking
a
a
Cindy.
question.
go ahead.
Now you're mute, Cindy.
Sorry.
Committee reports, none.
Can't hear.
We're on page
Yeah,
3, where it says
There's
committee
something
reports.
wrong with the library. Yeah,
My screen's saying Cindy's bandwidth is low too. Everyone seems to have that problem.
yeah, there's probably a lot going on in town tonight. You're finding something on page 3, Cindy?
Yeah,
You'll find something on.
check the chat.
Yeah, but we're not on that. We're voting on the secretary's report.
This is the secretary's report.
Okay.
Committee reports. No.
So what's
Hold on.
wrong? What was the report? What was reported? Is there something missing? Is that what you're saying?
No, can you hear me to start with? You can't hear me.
I can
Um,
right now. I can.
I
Okay.
can hear you.
It's
Okay.
simply like a typo under where it says correspondence, none. That is correct. Then it says committee reports, none. Committee reports is a heading for the whole section of budget, buildings, grounds, friends, etc. So by saying committee reports, none, that's an error.
All right, I'll,
You're not
let's
following.
see. I got it. I found it. It was
Okay.
gone and I got it now.
Yeah, we'll just remove the word none.
Right.
Oh, I see what you're saying. Okay. Yep.
Oh, so just take out the word none. Is that what you're saying, Cindy?
Okay.
Got it. Okay. Anybody else? All right, so we'll do a roll call vote. Chris? Say
Here.
aye or
Yes.
nay? Laura?
Aye.
Yay.
Susan?
Yay.
Aye.
Amy?
Aye.
Cindy?
Aye.
Tim?
Yep, I,
Adam?
Yay.
Jeff?
Aye.
All right. Motion to accept the monthly staff reports.
so moved.
All right, Tim,
Second.
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 Chris? Discussion.
Was that
I had a quick-
Amy seconding?
I was one of them. Sure.
I had a question about the budget for next year. So with the, you said the town administrator asked us to cut 50,000 from our budget for next year. And that's in general precaution based on the economy. Is that basically what we're looking at?
Yes, that's based on his estimates of the reduction that we will see from the state. So his original estimates had covered things that he cut across the board, which was capital. And then there was an additional reduction that he anticipates. So he went through, we weren't the only ones. He went to every, you may have seen in the newspaper, the school committee is cutting 400,000
Mhm.
from theirs. I don't really know that it's a true cut at this point because those budgets haven't been approved. It's more a readjustment of what we're gonna put forward. In part, I think he got the number because it's pretty much gonna be Sunday. And we agreed that Sunday was a good elimination because we're closed at this point anyway, and people aren't in the building. So to not, it's not a dangerous loss for us.
What is I guess out of that, what is the cost of running Sunday? Is it exactly that amount or is it?
It's about
if-
45,000.
And that's for the whole year?
That's for the whole year. Yeah. And it's mostly because it's 3 floors and so it's in part to do with the size of the building.
So if let's say the cuts aren't as bad as we thought, or there is more in the budget halfway through next fiscal year, if we get $25,000 back, we could reopen for the second half of the year?
Yes, exactly. And that would happen in November. At the November town meeting, any reductions that are made now could be put back at the November town meeting. I think that's very unlikely. I wouldn't be putting any bets that that's what's going to happen, but technically that's the plan. That if somehow
Yeah, I
receipts
guess.
improve, say we've got federal money, for instance. If receipts improved, we could see that come back.
Yeah, and I guess that's my thought would be, I mean, I'm a big fan of Sundays being open at the library. I think weekends are great. I know we get to cut something, and I think that seems like a pretty painless cut in terms of our full-time staff and our, you know, our bigger picture stuff. But I would just be interested in trying to explore other ways to try to bring back Sundays if it wasn't going to be through the town budget, whether it's working with the friends or working on fundraising and things like that.
Yeah, everybody loves Sunday. So I think strategically, it's also a good thing to eliminate because everybody's going to want that back. So that's not something we're going to have to plead for. That's something that everybody's going to want to get back. And they were very proud of it when they were able to institute it. So it is a high priority item. And as I said, for this particular year, I don't think it's going to hurt us too much because we have bigger fish to fry at this point. And Sundays are not going to be the hours are going to be different no matter what.
Yeah, I'd just be worried about a scenario where it just, you know, once stuff gets cut, it's hard to bring back, right? So if this is
yes, but that's exactly what I'm saying. This is actually strategically, this is easier to get back because it is so well loved. It's not essential, but it is really, people do like it.
So it would have a lot of support to bring back.
It would have a lot of support to bring it back. Yes. Everybody at town hall, like, you know, the town council likes it. Everybody supports it. So I do think it would be relatively, there's a good chance we will get that back if the money's there.
It's only 4 hours, so it doesn't really affect our MAR, right? Well, our
No, it doesn't.
certification.
Right. No, there isn't anything that I ran all those numbers and I spoke, the FinCom is reviewing it too. So I spoke to Dan Sherman to make sure that those numbers are all okay.
All right.
Catherine, was there anything on the, are we going to save money on operations of the building itself, like electrical and, you know, things like that, that could also contribute to that?
It's not showing up yet.
Yeah.
I'm not seeing any, it's only been a couple of months, but I've had a utility bill and it's not showing up. It might show up in water. It just hasn't been long enough. And there's no way to anticipate that in advance. So looking at FY21, I don't know how to anticipate that.
Yeah.
Because you don't even know necessarily what the costs are going to be. You could use less energy and all the costs go up.
Mm-hmm. Okay.
I miss maybe jumping out, but oh, sorry, go ahead, Cindy.
Oh, I thought looking at the budget sheet that perhaps there was going to be some funds left over in the personnel services this year. Did I read that correctly?
There will be.
Okay.
Yeah, there will be. That's in part due to a position that was empty for a significant amount of time at the beginning of the fiscal year. All last summer we had a position open, so that money accrued and we never had to expend it. So that will go back to the town and they'll be happy. Under the circumstances, yeah, every bit they can get back, they'll be happy to get.
I didn't know if you guys were going to plan on going over this later, but do you have kind of a rough plan for reopening? I know I saw that what you sent from the other towns, and do you guys have a rough idea? I know most of the stuff just came out this week, so.
Yeah, that's the last new business item. There's there's an entire service plan at the end of the packet.
May
So
12th COVID draft.
Yeah.
yeah, so that draft will go over that.
Anything else from anybody?
I just want to check in on the next Friends meeting. Chris, it looks like you're assigned to that. I'm just asking
Yeah.
because I'm the backup. Are you planning to go? And
I'm planning to go. I just don't know how and what. Someone's going to send me a Zoom link to that?
I have
assume?
the information.
Yeah.
I can send it right to you today.
Okay, that'd be great. Thank you.
Yep.
What,
if you end up having a conflict, just let me know and I can
thank you.
come back.
You offhand, you know what time it is?
7 on
Okay.
the 4th of June.
Yep, I saw that. What's the annual meeting?
Is it the 4th of
It's gonna be
June or?
fabulous. Do I get,
4th
do I
of
bring a
June.
glass of wine to work
Sangria.
for the annual meeting?
Yeah.
Elections.
You have a special guest speaker for the annual meeting?
Me, I'm on the nominating committee.
Excellent.
All right, anything else from anybody? Okay, hearing nothing, we'll do a roll call vote. Chris, are you favor? Say aye or nay?
Aye.
Aye. Laura,
Aye.
Susan,
Aye.
Amy,
Aye.
Cindy,
Aye.
Tim,
Aye.
Adam,
Aye.
Jeff.
Aye.
All right. That motion passes. Public participation, nothing. Correspondence. I didn't see
None.
any. Committee reports, budget, we talked about that briefly. Anything further to add on budget? Anyone?
No, I don't think so.
No, okay. Building and grounds, anything, Tim?
No, nothing. Nothing's changed.
All right. Friends?
I went to Friends, or participated by listening for 2 hours of the Friends meeting. They really were just talking about how to get organized enough to actually have a working committee. And what is the work going to be, where the library is not currently open. And at that time, there was really no plan in place at all. So there was just a lot of discussion about that. And they were
Okay.
not quite sure how to have their annual meeting. So I don't know if they've talked about it since, but they were
I'm bringing
talking about
wine.
that as well. What did you say?
I'm bringing wine to the meeting.
There you go. Well, Cindy had said that there were some people that were interested, that they were going to, contact from that event they had, but not knowing what the future opening is, was kind of the stumbling block of really getting much done. Did I sum that up?
Well, I can add to that. There were 40 people who attended the March open house event. And from those 40 people, plus some others that we know, a full slate has been prepared to fill the 4 director spots and the 5 officer spots. So
Oh,
they're going to go forward with a really good crew of people.
Awesome.
And they are having a Zoom-based annual meeting. And we'll not be having the annual book sale because everything is closed down. You can't have, gatherings of large groups. But otherwise, they've got good people coming in place. So the future looks good for them.
Well, that's awesome to hear, because the 2-hour Friends meeting was really circling back to what can we do, what can we do, what can we do? So that's awesome to hear.
There's a lot of progress since that meeting.
Good.
Cindy, is it a lot of new faces or kind of restructuring the same group that's been volunteering for a few years?
Some new faces. Jody Sherman is stepping down as a director. to allow a new person to come on, because otherwise all four of the directors would be continuing. So the new person who's stepping on is Michael Nestor, who was one of the trustee applicants last year. And he's very excited about that. There's a new assistant treasurer coming on who is new to the Friends, Tracy Vincent, who's been active in another group in town, and as her husband has been as well. And she comes on with treasurer experience. There's Helen Van Bottenschoen. I think I got that wrong. I have it printed out. And she has been a member of the Friends and helped with the book sale, but she's not had a officer or director position. So she's stepping up to be president. Anne Marie Pasquale, who's worked on the PR for the book sale and has been a friend for quite a while, is stepping up to be vice president. So you got two people who are knowledgeable with Friends and know a lot of core people with the Friends, stepping into roles that they haven't been in, but they're very comfortable doing that. And they have the full confidence of the rest of the board. So it looks great. And the new secretary is Karen Williams, who worked with me in Girl Scouts. I was the town registrar and she was a Girl Scout leader for quite a number of years. And she was also interested in the treasurer spot, but interested in leadership. So I told her that secretary is a key pin because you've got you're the information handler and you work very closely with the president and vice president. You're kind of a linchpin there. So she's agreed to take that on. So that's terrific.
Great, that's really awesome.
Yeah, yeah.
Be nice to see her.
Yeah, it's a good blend of ages and male, female between the board and the directors and the committee chairs. So it looks great.
All right. Gift funds.
I have nothing to add to what Catherine sent out.
I had one question on. I just had one question on that quickly. So on the, I just noticed on the Lewis Day Memorial Fund, on the March 31st, it showed a principal balance of 133,000, and then the April one was 143,000. So a $10,000 increase from the, looks like, current principal. Did we get additional 10,000?
So it's either an increase or a typo. No. So that's what it's either, can you hear me? It says my internet connection is unstable. It's either a, I don't think it's a typo because
You see where I'm at?
No, because I don't have it in front of me.
Oh, okay.
I should. I have so many things open here. Here it is. Okay.
So if you look under current principal.
Yeah.
For the Lewis, and in the March 31st one, it was 133,000. And then in April,
yeah,
it was 143,000.
Yeah, the principal. That, what?
They're all added that way.
They're what?
They're all added that way. The current principal and the total prior income on all of the funds adds those two columns and puts it into the current total.
Okay, you're talking about current principal. Is that what you're looking at?
Yeah.
That's gonna, the current principal is going to vary. Let's see. Based on the monthly income. That is, yeah, it changes all the time. That's,
it could be, it seems significant to me, 10,000 from one month to the next.
Yeah, that was a significant month.
Okay.
I believe it was, you know, we had trouble in the market that month. I have individual statements for each of these funds that this is drawn from. This is all from First Financial Trust.
Yep.
So I can give the board all of those. You can see all of those statements to see each of those funds has like 3 pages of statement. Also, the other thing is that Rick said he would come to a meeting. He usually does that annually. So he would come to a meeting and explain what has happened in the last 12 months.
Yeah, no, it's certainly been volatile.
Yeah, well, the last 3 months has been slightly volatile. And
Okay.
it was not as volatile as I expected it to be.
Yep.
You know, based on like personal things that you see from retirement stuff, IRAs and things like that. I've heard of people bouncing all over the place, and this was relatively stable, I thought.
Yeah, I mean, the income itself was actually it's down by 3,000, you know, but the principal was down, you know, almost $60,000, looks like, you know, from month to month. But the income wasn't significantly different, you know, so okay. That's the only thing I noticed.
Yeah, we probably need to review those entire statements to show how the whole thing is balanced and how it works.
Yeah. Yeah. Okay. Thank you, Catherine.
Okay.
All right. Legislative advocacy, Cindy?
The virtual library legislative day was held. Catherine, you attended, I did not. You want to talk about that?
Jackie attended. I did not. I signed up, but I didn't get on there.
Me too.
I didn't get on in time. It wasn't that long. It was.
No,
it was just an hour. Yeah.
Right.
Yeah.
I was
Did you say they
doing 2
recorded
meetings at once. It was
I
recorded.
tried to find a recording. I couldn't find one.
It said it was being recorded. I don't know if you have to. Typically, they send it to you if you were registered, but you're right. I didn't see a follow-up email from that.
I didn't see it on the website either on MLA.
Right. I checked the website today. I checked both MBLC and MLA, and I didn't find anything. But I can follow through and check to see if there's access to it, and then can let everybody know where they can view it. I have nothing else for legislative advocacy.
Okay.
Thank you.
Oh, they're in the middle of the meeting.
Dan Sherman's in the house. Hey, Dan.
Greetings and salutations. So it just so happens I was thinking about you guys. I just sent a message to Catherine because I had a couple of questions, and so I thought, well, let me try Cindy. And Cindy says, well, I'm in the middle of a trustees meeting. Oh, okay. So I decided to join you. I assumed you guys, since the budget was early on in tonight's agenda, so my pardons, please excuse my late arrival. So I'm wondering what you guys had decided to do or what your thoughts were regarding the proposed $50,000 reduction.
What I think the consensus was that we're going to take it out of the Sunday openings.
That much I understand. That doesn't tell me your opinion, though.
Oh, well, I think the opinion is that it seemed like the best of the worst options, in that, as we talked about, if for some miracle we get additional funds halfway through the fiscal year, that would be an easier item to request that it be put back in place rather than having some other items, because it's a popular benefit to the town, and I think most people enjoy it. And if there were sufficient funds to allow for that to happen midway through, then we would ask the town, and we think that that'd be an easier sell, and people would support it at the November town meeting.
Yeah, in November.
Yeah.
So, I mean, actually, you just answered one of the questions I just sent to Kathy in an email. is I remember seeing the statistics that Sharon provided a number of years ago, shortly after the Sunday hours were reinstated, that showed that it was quite popular. In fact, might have been the most popular time frame. If you do it, as an hour by hour kind of analysis, it was very popular. And so I got to thinking about that in terms of, does it make sense that the Sunday hours is what gets cut since it's the most popular? And that got me thinking about, other options, if there are any other options. I know that Steve mentioned Sunday hours. You just mentioned Sunday hours as being the easiest, but I'm just wondering if there are other options, or if you've entertained or looked at any other options for the 50 grand.
Well, it's a little bit complicated by the fact that Sundays are paid at time and a half. That's part of it. I'm trying to think what else that it is.
It's also
Anecdotally, I can tell you about the statistics, that early on those statistics were really high, and the traffic is still very good. It's definitely used, and the statistics are good. Not as high as it was initially. I think what a lot of people like is to come in and study. So it's not so much the circulation, it's the space. The space is very important. So that kind of plays toward, you want to be open then, because that's when people are using the space. They use it to study. But part of the reason I thought it was a good call this year in particular is because we're not open to the public right now. So to fund Sundays, when it's a day we're probably not going to be open anyway, I don't know how many months it's going to be. It's still kind of early to figure that out.
Yeah, I would assume you haven't got any guidance from the state yet in terms of the rules or when to reopen or anything like that.
No, not really. It's a little bit all over the place.
2 questions.
The advantage is one of the advantages of this closing on Sundays as well, because it's only 4 hours compared to any other day of the week, that if you, I know there'll be new cleaning protocols probably put in place, but that gives you 1 full day with no one in the building. And that might just be from a public health standpoint, that might be a benefit. If you need to do a deeper cleaning, or you just need to kind of give some space. I don't know. That was my other reason why I thought that was a good option.
from a scheduling perspective, it's typically temporary staff, and it changes every single week. Right now, we're leaning toward people working in teams, and they all having set schedules so that we could better, if anything happens, we can contact trace. Sunday would really complicate that.
Okay. All right. Well, that's all very helpful.
I have 2 questions, one for Dan and one for Catherine. Catherine, how much is it we're expecting to return to the town in unused personnel costs this year?
Say 50,000.
There's our 50,000.
It is, but it's not quite the same. I mean, I think, I don't know, Dan might know this better than I do. I think the overall picture is for both, they want to get through this year. And then there's also what's going to happen next year is very, very up in the air.
Everything is up in the air.
Yeah, everything's kind of up in the air. I want to, we're the library and we want to do the best thing for the library, but the library is part of the town. So we also want to do what's best for the town. And we did have this windfall this year in personal services. So we can say we gave that personal services back. But I don't know that changes things really for next year.
Right.
Next year there's, I think the money we're giving back is going to help fill a hole that exists now or could potentially exist within a month.
Okay, my other question for Dan is, I haven't seen in the paper, and I didn't watch any WCAT meetings that would give me this answer. How much were other departments asked to cut from their budget? And were the cuts done as a percentage of each budget? I've only heard about the library and the school department.
Yeah, so it was not done on a percentage. We looked at the schools, and Steve came up with $400,000. And I think part of his $400,000 was the fact that they were asking for an increase of 4.88%.
Yeah.
And by cutting 400,000, it got them down below 4, which is the number that I've been giving to schools for a long period of time. It says, you guys just can't do that. You got to cut back. So I think that 400,000 came from there. He also looked at not hiring positions, and there's going to be an interesting discussion tomorrow night regarding the economic development position, which is Paul Revis's spot. Paul is retiring. That's freeing up, I want to say $85,000 or $90,000. He's put in $95,000 for that spot, but he's also told DPW, fire, police not to hire anybody new, and if somebody leaves, no backfilling. So we're looking at each of those as a case-by-case basis. So it's not a broad brush affair. So DPW was cut $110,000 because they have a position that we're not going to fill, at least not yet. Police got cut $38,000 because we don't need them for the 4th of July parade. That saved $38,000 there. We cut $100,000 out of the healthcare budget because we expect about $250,000 to come back to the general fund in that 2021 year. So we're slowly increasing that, and the healthcare budget's been returning money to general fund pretty steadily, but it's going down. Hi, Kevin. The other spot, let's see, the $95,000 for the economic director was put back by the town councilors on a vote of 4-3. And I've actually received notes and talked to Paul Donaco and Jonathan Chines, who both voted to reinstate the $95,000 for that position. They want to talk to us tomorrow night, so that could be a very interesting discussions. I know some of the FinCom members saying if we're not going to backfill, if we're going to cut areas, we should not backfill Paul Revis' spot. And I think there was some stuff in the paper about that. So those are the spots we're looking at now. We're also going to we have a OPEB right now is $1.65 million on the budget. We're going to leave it in there, but we're not going to put the money in the trust until like June 30th. Because if we determine at the end of 21 that we're running short on revenue, that 1.6 million will not be spent. It'll just stay in the general fund to cover later. The other thing we've cut is $1 million out of capital. It's a $2.1 million capital budget. We cut that down to about 1.1. So we cut $1 million out of that. And again, that will resurface in fall town meeting when we know or don't know about our numbers. If our numbers are good, we can put the money back in for capital. We can put the money back in for Sunday hours, assuming you guys could actually open the library in 2021. That's another question. But right now, those are the items that we're cutting. We've cut a little over $2 million out of what was originally proposed in the budgets out of our roughly $100 million total.
Thank you.
You're welcome. The other thought I had is just to remind everybody there that we are discussing the library budget tomorrow evening via Zoom. So if anybody wants to participate, it is public and you're welcome to join us. I'm going to encourage Catherine to join us because I know that $50,000 is going to come up. And there may be questions from FinCom members regarding the impact and Sunday hours and so forth and so on. So hopefully, Catherine, you can join us.
Yeah, I'll do that.
That's all I had.
Thank you.
That's
The
good.
chairman is muted.
Thank you, Dan.
Okay.
Good information as always. We always appreciate the insight and the really thoughtful analysis that you bring to not only our budget but to the town itself. It's really helpful to me, and I'm sure to the rest of the board too. So we really appreciate it.
Well, thank you. One of the things that you haven't seen yet that I just about to wrap up is a PowerPoint presentation that I've done every year in the past. This year it's a lot different at the end because I do a forecast at the end and I have a pretty good idea what's going to happen in the coming years. Well, this year, not so much. And so what I've done is what I would call a best case, a bad case, and a worst case set of scenarios. So we'll see how those play out, but it's a bigger struggle this year to try to put that stuff together, a much bigger struggle.
Well, you're not alone, if that's any comfort.
Yeah, that's true.
Well, confusing.
Thanks very much,
Okay.
Dan. Appreciate it.
All right.
And I'll see you
Go
tomorrow.
Okay, anything on moving on to personnel? Anything on personnel? No? All right, that's all on committee reports. Board reorganization. And I know, Cindy, you had sent something I saw right before the meeting about whether or not we can, by bylaw, reorganize the board prior to an election.
Right, we can't have our elections until after the town has had its elections unless we give 2 weeks notice to the town.
Okay.
And we didn't post our meeting 2 weeks beforehand. So we could do our committees, but we can't do the election of the chair.
Well, I'd recommend just keeping it the way it is for right now, if everyone's good with that, and then we'll just see how things go till, after the election in June. Is it June? Yeah.
June.
We must do
Yeah,
everything.
we may have to change the meeting so that it follows the election.
Okay.
We can do that. Typically, we have what? Did you say something, Susan?
Yeah, how come they could do it for town council? They did it and elected the new chair at the end of the last meeting because there's no change. There's no potential change. There was nobody running for.
Yeah, and when I looked at the bylaws, they are a multi-member board just like we are, so I don't see how they could do it. There must be something else in the charter or bylaws that I didn't dig deep enough to find. I'm not sure if they just gave more notice, because I did not see it spelled out in the section of the bylaws that pertains to us.
Yeah, and I have always just gone by what we did the year before. So I'm not looking at dates. I'm just, and I like the idea of putting it on more than one agenda. If you do your annual meeting in June, you can do all these things in June. But if you have questions that go on to the next month, then you're running into the summertime. So I like kind of bringing the draft in May, and then you can finalize in June if you have to. So that turned out to be in our favor tonight, because if we actually are not supposed to vote, and we're not supposed to vote until after an election, we should make the next meeting after the election.
Yeah.
Or we just post 2 weeks before our next meeting date.
Or post,
before the election.
yeah.
Just
I
post
could do
that
that too.
information separately. You don't have to post the whole agenda, just post that information.
Right, I can post it tomorrow, actually, if we do want to stick, you're right. If we do want to stick with the 17th, I'll just post tomorrow.
Okay, that's fine. All right. Holiday schedule. We get a copy of the holiday schedule.
We did.
Yes.
I don't recall anything being unusual about next year.
As long as it's not this year.
Does anyone have any questions on the holiday schedule?
No, it looks good.
Okay, can I get a motion then to accept the 2021 holiday schedule?
So moved.
So moved.
To approve.
Okay. Second,
Second. I didn't get the
second,
first one.
Chris. Thank you. Any further discussion? Okay, no further discussion. Roll call vote. Chris,
Aye.
Laura,
Aye.
Susan,
Aye.
Amy,
Aye.
Cindy,
Yes, aye.
Tim,
Aye.
Adam,
Aye.
Jeff.
Aye.
Okay, that motion passes. Next item is COVID-19 reopening plan draft. Catherine, you want to just
Okay.
Can I
start
actually,
this?
sorry, Kevin, can I ask a question about the holiday schedule? I know I just said aye, I'm sorry.
Sure.
Yeah.
The 4th of July falls on a Sunday. So, but it only lists that it'll be closed Monday. Do we need to specify somehow? I mean, this is kind of further complicated because we may not be open on Sundays anyways. Is it just assumed that it'll be closed on Sunday the 4th plus Monday the 5th?
Yes, it's actually saying that Sunday, July 4th, we're closed. Closed Monday is the extra day.
Extra,
So
okay. Sorry.
So the last column that's in italics, that's the extra time that we're closed. So for Christmas, in the very first one where it says December 25th, the Friday, that's when we're closed. And then Thursday, the day before, we close at 1. And we're also closing on Saturday.
Thank you. Sorry for not catching that before.
That's okay. It's not very clear, actually.
Thank you.
Just when you do it for 20 years.
Kevin, are we going to talk about the choice of the meeting dates? That was,
We can do that next month with the,
Committees.
yeah, with the
No,
committee and stuff.
not the committees. You have two proposed schedules for the Board of Trustees meeting.
Right. Do you want to do that with the, or you want to do it now?
Doesn't matter. I just was, before I turned the page, we were doing it now.
Sure,
Yeah,
we can
I
do
don't
that
know.
now.
Yeah, I didn't know if people had a preference.
Let me just grab it. Hold on.
Why don't we do it next month since the service plan is going to take so much time?
So it's just a couple of dates that are different, right? Catherine?
Yeah, you either pick the 4th Wednesday or the 3rd Wednesday. The 4th Wednesday actually works better for the library staff because they get more statistics. We're preparing the statistics and everything the week before. So it's a little bit easier when you do it that 4th Wednesday, but it doesn't matter that much. So if you preferred the 3rd, we could do that, either one. In both cases, there's an alternative because in the case of the 4th Wednesday, the holidays have to be changed. And in the case of the 3rd Wednesday, it conflicts with school vacation weeks. So in either schedule, there are 2 weeks that are off.
Well, judging by the start of them, I think we should do the 4th Wednesday because that gives you the month of September. If that
Yeah.
might be just getting back.
That's fine with me. Are people okay with the 4th Wednesday of the month?
I'm
Yeah.
fine with the 4th Wednesday. That works.
Yeah.
Okay.
Good to me.
Do we need a vote on it? I don't think so.
Make a motion to change to a fourth Wednesday of the month for the trustee meetings.
All right. There's a motion by Chris, second.
Second.
All right, second, Tim. Okay, roll call vote. All those in favor, Chris,
Aye.
Laura,
Aye.
Susan,
Aye.
Amy,
Aye.
Cindy,
Aye.
Tim,
Aye.
Adam,
Aye.
Jeff.
Aye.
All right, that motion carries. Would be the fourth Wednesday at 7 o'clock. All right. Thank you, Susan. All right, next item will be the COVID-19 plan.
Okay, so Jackie, jump in anytime. You either need to, you either need to rein me in or help me out. I'm going to start by saying that what I'm eventually going to want this board to do is I'm going to add a paragraph to this document that says that the Board of Library Trustees authorizes the library director to execute this plan in consultation with the town's emergency manager, Board of Health director, and/or the town administrator, with any adjustments to be made in accordance with current authoritative information. The director will notify trustees of any such changes. So I'm going to add that because I'm going to want this plan to be able to be public and to be supported by everybody involved in the library. So when inevitably somebody says, I wouldn't have done it that way, we can all say, this was not a single person who made this up. This was a person who discussed it with the town, who discussed it with the state, who discussed it with all of the library people involved, that kind of thing. Because as I'm digging into the weeds, it's very complicated. And we're going to end up with, not everybody's going to be happy. And I think my number one consideration, and the reason why it's a pandemic and an emergency, is that we do not want any illness traced back to BB Library. When they do contact tracing, you don't want someone to say, I got it at the library. That's where it was. We need to be able to do everything as carefully as possible so that we're not contributing to any kind of spread. Part of what's making this complicated is that there is no, just like the entire pandemic, there is really not mass regionalization of organization. We're all kind of on our own. And I've been working with the immediate budding towns, and we're all pretty much on the same page, but our timing is going to be different. And I realized that the timing is going to be different for everybody because our libraries are very different. So when Reading says they're going to do curbside delivery, or they're going to accept returns back, we don't even have returns back yet. You can't even return anything. So when Reading says they're going to let people return things, they have RFID and they have an automated return system. So that means a patron comes in, they drop it on a conveyor belt, and it drops into a bucket, and they can quarantine that for as long as they want. Nobody has to touch it. We don't have that system. We have a building from 1922, and everything is touched constantly. There are no workspaces where people are not on top of one another. There are no spaces that are blocked in where you don't get someone else's breath. So all of these things really have to be taken into consideration. We share a health director with Melrose. So the director of Melrose and I are using basically the same plan. Hers won't say town administrator, it will say mayor, but everything else is pretty much the same. I've made it as general as possible so we can kind of back off from things or go forward depending upon whether or not it seems like it's going to work. There are not a lot of details in the plan that you see here because those are still being worked out. The devil is in the details. But the summary at the top pretty much covers it, that our first phase is what we're doing now, remote work with virtual services. The second phase would be to continue that remote work, virtual services, get a limited number of staff in the library and allow them to place new orders, process books, and handle returns. We have about 13,000 materials out that we have to get back. We have to assume they are all infected. So we have to get those 13,000 pieces back, get them into quarantine before we can turn them over again and process them. The third phase would be to continue doing all of that and then institute a curbside pickup, which is what people really seem to want. And it sounds like it could be kind of simple, but what makes it complicated is that we're an organization that works with multiple, you do ILLs, you work with other libraries. There's no delivery right now. So if somebody says, I want a book from Wakefield, that makes sense. You go to the catalog, you can only have a book that's on our shelf. We go and get the book, we wrap it in brown paper, and we'll throw it in your car window as you drive by. Now, there's a good chance somebody's gonna return that in Saugus, or somebody from Saugus is gonna pick up a book and then return. So some of this stuff is not gonna end up, it's not gonna be like where at Sweet Bay, what goes into Sweet Bay and comes out is all the same. Things could start getting mixed up. And that could be okay too, but in a building like ours, there's not a lot of space for all that stuff. And you've got to put a date on it. When did you get it? Where does it go? All of that. We have to have an organization for that. It's not impossible, but it just has to be thought about. The fourth phase, I'm seeing as in-person public service by appointment. So that's somebody calls and says, I need a notary, I need help with whatever they need help with, reference help or document help or something. And if we limited it and it was by appointment, it means you can clean up, you can track those people, number one, because that's a state requirement. You have to be able to track everybody who comes in. And you can pretty much clean up in between people. By appointment 2 also protects us with restrooms, because if your public library is open, the restroom has to be available to anyone who enters. So if you have a population that maybe doesn't do well with rules, it might be best to work by appointment. So I don't know that that will happen, but that's the idea right now. Phase 5 would be once they say certain numbers of people can be in an enclosed space. Say you can get 10 people in an enclosed space and they think it's okay. Maybe we could have, I don't know, our meeting rooms are probably too small, but maybe we could do something in a room where people could sit together and we could start opening up. And then the phase 6 would be whatever the new normal is. I have no idea what the time element would be, but we are affected by what the town is doing. And the town just released a draft of their phase 1, which is opening up town hall. That's an office. So it fits under the state guideline of an office. In some ways, the library fits under the state guidelines for an office as well. So when we get the staff back in, all those office guidelines, we have to be able to follow. Everyone has to have a mask, everyone has to, all the things that everybody has to do. And we have to make sure we have all the equipment for everybody that they need. Equipment is an issue for us because we share everything. We share the phone, we share the computers, we share, you name it, we share it. There isn't anything we don't share. So everybody has to have their own supplies. So we've had to buy all new supplies and everything. so that we can manage that as well. So the town's plan is to get people get their staff into the building, and it's a limited number of staff, which is another thing. Both the governor and the town of Wakefield are repeatedly saying, we prefer you to work from home. We prefer you to stay home. So the preference is to stay home. So you're gonna have only key people in that building, as few as possible. And that's what the town is gonna do. The town is looking at getting their staff back in the building between June 1st and June 14th, and then working on a way to open to the public after that. Now, when they open to the public, you're going to have people limited coming in, going to a single window, and it will have a new screen on it, and everybody will be in a bubble. It'll, one person on an elevator, all of that. That would be a little more complicated for us because people come in for a different, they're not just coming in to pay a bill. They're coming in for different things. So that would be a little different for us. The other thing I'll mention is that Saugus is on the fast track. They have a smaller collection. They don't have much outstanding, and they've had people in the building for a while. So they're getting ready to open for curbside delivery. Their building is suited for it too. They have an atrium or something that they can use. So I'm a little nervous about Saugus opening because it's going to affect us. Messaging is going to be very, very important. That the public gets it. This is a complicated thing, and we need to make it simple and consistent so that the public knows what to expect, and doesn't feel like I don't want anybody to ever feel like somebody's bossing you around, or it's like, we don't want it to be rule oriented. You have to do it this way, you have to do it that way. It needs to sort of be instinctive. But the flip side of it is it's not going to be, because this is also new to everyone. I think it's going to take the staff a little while to understand that they have to stay away from one another. How many of you are in buildings now with working in offices? Are any of you in offices? You're in, right?
Yeah.
So if, with this plan from the state, the employer is responsible to make sure that the employees are trained in the distance stuff and the personal equipment stuff. And, you've got to have everybody trained on that. So today, for instance, I was talking to Dave. He was in the building, and I said, I see people outside all the time using the Wi-Fi. Put the furniture out. Just don't put the umbrellas up, and make sure that the signs are clear that we're closed. Make sure there's no lights on, but put those chairs out so people can sit. And then I went into the building to do some bills, and they're all too close. They're all together. Like, they can't be together. They have to be 6 feet apart. You don't want everybody sitting on top of one another. But, you don't think that way. You think, it's a community center, so you're thinking everybody should be together. I'm in the building, and there's 2 other people in the building, and I'm wanting to go to talk to them. And according to the guidelines, we're not supposed to be in one another's spaces. And, none of us have been tested. None of us know if we had it, if we're carrying it, if we're, it's such a mystery. We just don't know that much about it. So you kind of have to play by these rules, and the rules aren't intuitive. So that's going to be something that the training.
The rules will become intuitive. This is
you'll get used to it.
And so the problem lies in the intelligence of the people in the marketplace. Sorry, did I say that out loud?
You're being recorded. Yes, but everybody knows that. Everybody agrees with you. That is, and that's a huge consideration. Jackie and I were working on plans today, and every other comment was, you know, this is what we're going to do, and this is what we're going to do when all those people don't follow that rule. This is what we're going to do for all those people that are not going to do that. Even though, you know, you have to have a plan for that, because it's going to happen. Somebody's not going to understand that there's a way to do it. So,
Catherine, have you guys talked about any kind of like security person? You know, like the grocery stores, Costco, people who have, I was at Bank of America yesterday and they have someone at the door making sure you're wearing a mask. Or when you get to the stage where it's by appointment only, like how would you do it? Are you going to lock the doors and let people in? Or would there be somebody standing at like a guard? You know what I mean? Like not a police officer, but somebody
right.
to kind of maintain the...
We're not there yet, are we, Jackie? Because I never thought of that.
No.
No.
We're still at curbside.
We're still trying to,
Some kind of,
yeah, we're even kind of before
some kind of
curbside.
enforcement.
Jackie's working on a schedule that uses the minimum amount of people for the minimum amount of time in a rotating pattern. For right now, it's to process books and to circulate. Who's going to work circulation and who's going to get the new books in.
If I may, Catherine?
Yeah.
For the savings bank, we're looking at somebody we're calling a greeter. But the reason for the greeter is not necessarily that they're wearing a mask. We're going to want them to remove the mask for a second so we can get a picture of them in case they're coming in to rob the bank.
Oh
So
my
banks are a little different.
Yeah. Yeah.
Yeah,
I bet they don't want to open either.
I think, you know, first of all, thank you guys for doing all this work. I know just from my experience and doing it from from my end, there's a lot, and, you know, you're trying to make sure that you're doing everything. I think, you know, the first thing from my perspective as a member of the trustees and just as a human, the safety of the staff and the patrons is the most important thing. You know, whether people get their books on time or whether they get back to the Red Library, as long as the staff and the patrons are safe, that's the most important thing. I think from my just like looking through these phases, I think we would be almost irresponsible to do anything past phase 3 until we've been at that phase 3 of curbside for a long time. I don't think this is an area where we want to be an early adopter. Let's let Saugus make all the mistakes and then we learn from those mistakes. Not to throw Saugus under the bus on it, but I think that we're from a people in the community standpoint, I think that the push is going to be to get to that curbside pickup. And I think you will see a little bit of, oh, well, Saugus is doing it or Reading's doing it. Why aren't we doing it? But if it takes us another couple weeks because we want to make sure our staff are safe and the patrons are safe, then that's what it's going to take. And everybody's just going to have to be patient with it. But then beyond that, I mean, once we get to like that curbside pickup, there's so many things that we don't even know. We don't know, is it passed on books? Can we do circulation? Like there's so many things that we don't know that 2 months from now, we might know a little bit better. And I don't think there shouldn't be any rush. You guys shouldn't feel any rush to get people in the building. I think keep the Wi-Fi on, put the chairs 6 feet apart, see if we can set up doing like, you know, phone reference by phone or something like that, like doing those virtual services. But I don't know, you know, maybe I'm not thinking of it, but the value of doing like the appointment only thing, I can't imagine that's worth the hassle. Like I can't imagine what services you're going to be able to be giving that's worth the fact that you are going to have somebody who doesn't know it's appointment only, but they see people are in the library, so they're going to try to get in. And that's just putting your staff in a weird position of, you know, somebody comes in and says, I don't want to wear a mask for a medical condition. And you guys, we don't want to put you in a situation where you have to argue with somebody. So from my perspective, I would say curbside pickup, you know, stuff over the phone, digital stuff, and then let's stay there for as long as we can while we learn what's going on.
That makes me feel comfortable.
I think it's going to matter a lot what happens with school in September. I think everyone's, you know, the summer is almost here. It's going to be such an odd time anyway. But if kids go back to school, I think that's kind of be an indication that everything else is going to want to be open. And I'm not sure if they've even talked about that. I mean, you get mixed messages on that. So, I mean, I think summer is going to be such a weird summer anyway. I think
Yeah. Yeah.
it's
And
hard.
there is so much we don't know. There is a study being done on the federal level, specifically on library materials and what they hold and for how long they hold it. And some of the results are due out in the middle of June. So even that gives you a little bit more of an idea of what you're dealing with. I mean, because maybe it turns out there isn't anything there that's worth worrying about. But until we know that, it's not even just that it's coming into the building and it's being handled, but then it's going out again, and you're starting all over. You know, it's this repeating process. And it doesn't, the studies seem to say that it lasts too much on paper, but everything we have is covered with plastic. So we're really looking at plastic, not paper. So we'll see what comes out of that study too. The town seems to be taking a very cautious approach, and we do have to work within the town guidelines. Early on, I had asked, remember the day we closed, I said, can I just use the town protocol? So we're sort of in the same position as the senior center and the rec center. We're all sort of doing the same thing. And as I said, Melrose will be in the same position as we are because we're sharing a health agent. And I think she's very cautious and using the kinds of numbers that we would want to rely on. You know, we're kind of in a hot spot. Middlesex County is hotter than, you know, say out west. So we're going to want to do things a little slower, I think.
Catherine, has been any building sanitized? The library hasn't been sanitized since March, since it wasn't
Yes.
sanitized after it was closed, or was it?
It was sanitized after it was closed.
So it was.
It was.
Okay.
We did have it sanitized. I called DPW and got a reference. The people who did their building did ours. It took them 4 days to do it.
So they did all the public buildings to start like that? Like they did town hall, they did DPW?
Yeah, I don't know if they did it. I don't think they did the schools. I think the school did their own thing. But they did us and town hall.
Yeah, okay.
Do you anticipate any problem getting the supplies to do the sanitizing? I mean, I know, you know, I can't get Clorox wipes.
Yeah. We've been trying to get them for months. I've had, Dave has had orders in place since February. And he hasn't been able to get everything. So he talked to someone, I spoke to him today, and he's got like 3 different places going, and somebody from, he calls it AmSan, but it's not that anymore, it's something else. They have stuff, and he thinks he's gonna get that. So he's to the point now, he's got about $1,600 worth of goods that he hasn't been able to get.
So until you guys get it, you can't sanitize the 13,000 materials.
Well, we had the materials.
Things that are coming back in that need to be sanitized, or?
There isn't anything that you can sanitize those with.
Yeah, I think you just have
what they're thinking is you quarantine them. You give them an amount of time for everything to just die on them so that it's not live anymore. There's just dispute as to how much time that is. It can be anywhere from 24 hours to 14 days, depending on who you talk to. So I don't know. You've just got all these books sitting there waiting to not have cooties.
Yeah.
A discussion with the union at all?
In
Catherine?
addition to, oh, sorry, Kevin. To build on Adam's point about everyone's health being the #1 concern, should there be some language at the beginning of this document that kind of reinforces that, or in the draft document? I mean, there's some good stuff there about how, you know, with guidance of the state and based on current circumstances, but really, and I've just seen different organizations do this too, just to reiterate what Adam said, that, you know, this is that based on, you know, health and safety is a top priority, just instead of it just being a, we're trying to tell you what to do kind of thing. It's more, you know, setting the stage
You want a
as
mission
to,
statement for the document?
yeah, maybe not, something along those lines. It just kind of, it seems intuitive. We all know that why this is this, but that we're taking these steps in this order to ensure, you know, the best health and safety for patrons, staff, and the greater community, something like that.
Right. So what you're describing, it looks like it's what the one that I have for the that I got from the town today. Her plan actually starts on the second page, and it's like what I have. But the first page, it's, you know, it's sort of saying that what you're describing what the function is and what the goal is behind having the plan. So I can do that as a separate introductory paragraph or page, and then it's sort of defining
something along. So look, it's in addition to what you said earlier about the paragraph you're going to add, that it's not, this is not just you, the executive director, just, you know what I mean? Like, it's, there's a greater reason why these precautions are being taken.
Well, there's also more than one person who is
Developing it.
implementing this, laying it out.
Yeah. I just feel like it's, I don't know, just to be as transparent but also thorough as, you know, just
Safety in numbers, that you're all doing the same thing, supporting the same thing. Because that's not the case out there in the public. Even in Wakefield, I'm not wearing a mask. I'm going to wear a mask. It's crazy.
I know.
They can't stop me from going in someplace. I mean, I'm seeing that on Facebook, a whole little group of, it's like scary.
Yeah, because it's a
Back to the
public
other
health
point.
emergency. It's not really a.
Security.
So what is it that I want to say? Do I just want a paragraph before the document itself?
Well, this document doesn't seem like it was actually written for public dissemination. It's not written in a way that's, you know, a read through. It's written more as in, you know, steps for the staff or for.
Right.
So were you planning on writing something more textual to use as a?
This is totally different from what goes to the public.
Right.
This may possibly be on the website, so anybody who's interested can see it.
Right.
But I will work with Jen McDonald at Town Hall.
Okay.
And we'll put together something that explains to people what's going to happen
In a user-friendly way.
Oh yeah.
Yeah,
Well,
because
if we can
this
do a chart or something, we will.
Oh.
Yeah, it needs to be consistent and simple, with sort of a link to, if you want more information, here's more information. And then as we move forward, we'll be getting even more information. So that information will become more current or more detailed as we move on. But what is messaged to the public will need to be broad and clear and consistent. And I'm hoping it's even consistent with Melrose, that it's some kind of, and if we could work up a graphic with it, that would be really good. The state has a lot of phased graphics.
Yeah.
Yeah.
Yeah. Okay. Sorry, I should have asked that to start, if this was an internal or external communication.
So it's internal, but everything that we have that's internal is eventually external. I mean, it's all public. It's all a matter of public record, but this is really just for our use. This is so I'm getting from you the authority to come up with a plan very similar to this. If this plan changes, it will be changing in relation to what I've been told by, town management team. And if it changes, I would be responsible to tell you what those changes are as they happen. So that's really the purpose of the document. And then the messaging, I'll probably bring that back to you separately.
Sounds like a good plan.
Yeah, very thorough.
Catherine, have you had a discussion at all with the union on this stuff too?
No, union members, because they're all on the team that works with it. We have task forces for everything. So Megan Kinton, who's the head of circulation, she's working very closely with us on how this is all going to work. So no, I haven't seen, there hasn't been anything that has hit me yet as necessary to report to the union. If I saw significant changes in people's, what do you call it, Jackie? Your work.
Environment, I guess. I mean,
yeah, and
it will, but.
Yeah, but even that's very broad. Like the first page of the union contract gives management all kinds of authority. You just have to play by the rules in the other paragraphs, which we have. So I haven't, but I'll pay attention to that if there's anything I think they need to know.
Okay, I just speaking from my own experience, my personal experience of dealing with this issue directly, phasing in, the workforce to deal with coming back to work and things like that, getting PPE to the appropriate people, making sure they have the PPE they need.
Right.
And then at some point, I've seen in buildings what they're doing now is just having flow one way in, one way out. So I would imagine at some point coming in from Avon, exiting on Main Street. And then at some point potentially putting up plexiglass around the, where they do the checkouts and anywhere there's contact. So start thinking about those things, what the cost could be for that too. You know what I mean? So it may not be worth the cost to do that.
Right.
To retrofit some portion, blocking off some of the moving furniture around, moving things around to kind of segregate, isolate, do what you have to do to kind of maximize social distancing and gatherings. So I'm surprised the MBLC hasn't come out with anything for guidance.
I think part of the problem is that all the libraries are just so different.
Yeah.
We're all so different. So all of the things you just described, Town Hall is doing now, and you can see how it's going to work, and it's going to be pretty effective. It's not going. That's not going to. There isn't a piece of plexiglass that's going to help us. The desk is the way that we use those desks, and we're going to have to really change the locations and how we do things. Like we're going to have one everywhere that there's teamwork. We're going to have to reduce that to a single person, and they're going to have a lot of their own space, because unless they're in a bubble, it's a big open space, and that is further down the road. That is.
I guess my argument to that would be that looking at kind of phases 4, 5, and 6, is that I'm not sure I wouldn't just skip from phase 3 straight to phase 6 whenever we're in our new normal. I don't know. I think that the cost and the hassle until we're in a place where we feel comfortable opening the library, to have to try to retrofit the library to have limited people and, you can't sit here, you have to follow this flow. I don't see why we wouldn't just keep with curbside delivery, maybe some limited appointment stuff, until it's time to say, okay, here's the new normal, everything is open, where kids are back in school and everything. I don't just to the point of the cost, like to have to do, and whether it works or not, there's going to be an expectation from our employees, which I'm that we're going to be putting up the plexiglass and we're going to be doing all these things, and we're going to do that, and it's just going to cause more headache versus just getting really good at curbside pickup, right?
Yeah, I think the other thing that helps us is we have so much remote stuff. There's so much that's electronic that you can get. So that's also a benefit at this point. Because I think there's a lot of, there are a lot of things that we do that are those out of the building electronic things. And then the flip side of it is those really large group things. There's not a lot in the middle that's really as valuable as those two things on either end. So it might be that we really just hold tight and do curbside delivery, which can include documents. You can print from outside and you can send stuff to be printed and we can deliver those. We may be able to find lots of things that we can do remotely that satisfy people's needs until we get to a point when they can actually be in a room together and we no longer need plexiglass. I don't know how that's gonna fall out, but I do tend to think that the way our building is designed, it may not be,
It wouldn't work.
It may end up not being, it might not work. Or we might have to use just a really small part of it, like just use reference or something. I don't know. That's a little bit down. That's a little bit down the line, I think.
I think you're 3 to 6 months out to have that conversation like that, opening doors.
Yeah.
And I agree with that. Trying to retrofit and socially distance spaces in that building is going to be extremely difficult. And that's not factoring in people who don't care when they're in there.
Or don't know that they're not doing it.
Well, yeah,
You
so
know,
I really do agree with that on that. That curbside, let's see how good we can get at that till you can go back to, in essence, closer to, 80% or 90% speed.
Yeah.
I was wondering why you pushed curbside pickup off to phase 3. Seems like the demand for that would be very high for very early. Is that phase 3 as early as you think you could do it?
Yeah, it's more difficult to do. It's much more difficult to do because at that point you're talking about managing not just the materials but the people who are coming to get it. So someone says they want a book. What?
You need
somebody says
protocols for all that.
Yeah.
We also have to get back the 13,000 items that are out, which is not a small amount of items.
Yeah.
Right.
And deal with those. And that will take us 2 weeks to get those back.
So we don't want to be doing curbside at the same time we're trying to get the other stuff back. Because now you've got people crossing barriers that you don't necessarily want them to cross.
But phase 1, you have the returns coming in.
No,
we're in phase 1 right now.
We're in phase 1 right now. It's phase 2 where we'll take the materials in. And taking the materials in our goal is to get the materials back in a way that they are dropped into a container, dated, and pushed aside so that nobody has to touch them. Okay. And that is complicated because we have those little tiny doors that, okay, so somebody has to touch the door. So that means you got to keep cleaning it. And then they drop the thing in, and that is not going to hold the number of books that are going to go into that thing. They're going to end up all over the floor. Those drop boxes don't even last a long weekend. So because that's so complicated, we would like to try to direct people. We know not everyone will do it, but we'll try something like, if your name is A to F, if you could bring your stuff back on Monday, we'd appreciate it. And so you just get those, and the people who are in other part of the alphabet, know that their turn is coming up on Wednesday, say. So even if you don't get your day, but we're kind of covering it, and if we get them into some kind of bin that we can roll away when it's full, label it with a date, leave it for the amount of time it needs to be left. And then we have a whole other series of events that are going to have to happen with those big containers.
It's just
They all
like
have to be shelved.
people see takeout, with takeout for food, very similar to curbside pickup, because right now you go to Mandarin Reading, they have 2 sets of double doors, just like we do on Avon Street. You go into the first set of double doors, there's a table, and on the table are bags that have your name or your phone number on it. You pick up your bag and you walk out. You've already paid, just like you already would have called into the library to say what book you want. So it's prepared for you. It's put in a bag or wrapping. It's on the table. And I think the general public will think, how hard is curbside pickup? The restaurants have been doing it for 3 months already. That's
But they're not giving you pork fried rice that somebody else just ate.
Right. No, but that's going to be the perception.
Right. So that's why the messaging is going to be so important. It needs to
Absolutely.
be simple and it needs to be clear.
Absolutely.
And you want people to have the sense, because it's true, that there's nobody who wants to be doing this more than a librarian. I mean, none of us are happy being home. None of us are happy. This is not what we signed up for. This is not librarianship. Figuring out how to manipulate this whole system, that's not what we do. So this is hard for us too, and we want the public to get what they need. And we need them to understand why it's so complicated and why we're being cautious.
Mm-hmm.
But you have to do it in a sentence, because nobody's gonna, they don't care. Like you said, they see, maybe part of it is we don't call it curbside pickup. Maybe that term is not a good term, because people are thinking, this is just like when I go to Sweet Bay. I don't understand why I can't have this.
On demand. Something, because like if I go to Public Kitchen, I can get curbside pickup, but I can also get a growler of beer. I pay a $5 deposit on that growler of beer, but then I cannot bring that growler back and refill it. So I don't get my deposit back.
Not for a couple months.
It still works, but I mean, I get the point of, it's not the same as a restaurant. We're not returning things to restaurants.
Right.
And I think it's an equal mix of placating the people who are saying, open, 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 why can't I come get books? But there's a whole other half of Wakefield who's saying, are you sure? How do I know you're cleaning these books? Like, are you sure you're ready for this?
I know.
Making both sides happy that, yes, we want to get you the material, but we also want to guarantee to the people who are concerned about it that it's safe.
Right. And I'm getting emails. We had an email today from somebody who asked very general questions. And when I answered them, she emailed back and said, I really miss the library, but I'm wondering when it's ever going to be safe. So as much as she wants to get, and she's a building user, so she wanted to be in the building. That's pretty much what her question was about. Even though she asked about fines, she had very many questions, but the bottom line was that she misses the building, but she doesn't want to go back unless it's safe. So I think people are looking for the information. So I'm anxious to put the information out there, but it does have to be the right messaging. So I'll work with Jen at Town Hall, and she has some graphic design experience, and she's really good with language. She's good with writing that kind of marketing language. I'm too wordy. I can give her the big thing and she can cut it down. And she's probably
Catherine,
good with graphics too.
One other, I'm sure you guys have thought about this, but in terms of trying to kind of like protocols will be different, has any consideration been made to changing the checkout time periods? I feel like 3 weeks is a standard and it's a fair amount of time, but is there any rationale or any potential of encouraging people to kind of check out more books for a longer period of time to kind of decrease some of the frequency of people having to come and pick up things. You know, if I had maybe if I had 5 weeks, or I don't know if there's.
I didn't think of
they
it.
They could renew as well, but.
Yeah, I didn't think of it in terms of time period, because Jackie said something today. Would we want to have any limits on how many things people take out? Because we typically don't, unless we think there are other people who need it. And that was something that we had come up with, is that, well, yeah, let them have as much as they want, because then it's fewer trips back. But if it was a longer time period, I don't know. We'd have to, we also have to see where we fit with everyone else in Noble. And so all of those policies have to go into the go through Noble, because they're the ILS, what is that called? The computer system, the
Evergreen.
catalog. Evergreen is their bailiwick. So we would want to kind of coordinate that. And a lot of people use multiple libraries, so you don't want to confuse them too much either. So we'd have to give that a lot of thought.
Is there a way in the online catalog to lock down? So if people want to, order books for curbside pickup, to make it so that it can only be books that are at our library? Can we sort of, push a button that eliminates them being able to order something that was in Reading or?
Because they wouldn't be able to pick it up in Wakefield.
Right, that's what I'm saying. Like, I know if I go search a book on the catalog, it'll show me where it's at. But what's going to stop someone from selecting a book that needs to be shipped in? Like,
it just won't be fulfilled. It won't matter. The hold will just die. Currently, that's what happens. It just goes unfulfilled.
Like, I wonder, is there a way to notify them and say, I'm sorry, this is not in Wakefield. You can't get this.
I think that's one of the settings there was a whole list. They sent out an email of a whole list of settings that they're changing for situations like that. I'm not sure exactly. I think it said, Catherine, didn't it, that it was only going to be set to local holds? It already sort of works like that.
It said that. I just don't know what happens when they do that setting.
Well, that already exists. So if you place a hold on something that we don't yet own, like if we just haven't purchased it yet, if the other libraries have something called age hold protection on it, it will kick it back to you and say, you can't place this hold yet because there isn't a copy to fulfill it. So I'm pretty sure that can be turned on. And that might be, I think that's one of the things they are turning on. So it would tell you that that's not going to happen. And the hold would just sit there and you would see it not being fulfilled.
Could I order something from Reading and go pick it up in Reading?
Yes.
Yes, as long as you change your pickup. Yeah.
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 Jackie, did you see the message that came out from the state today?
Which one?
Mary Rose Quinn. So this has to do with state aid.
Oh no.
There has been all this talk about curbside pickup, and you're only going to do your local stuff, but you have to serve people from you can't just serve Wakefield residents. You have to serve every card holder who comes. So that increases the possibility that someone comes from Stoneham to get that book and then returns their Reading book while they're at your facility. And if we're not moving the stuff around, it means that has to go into a bin to go back to its home library, but there's no one to take it there yet. Because that delivery service is statewide and it's through a particular company and they're not working yet. So that's one of the things we're going to have to try to take into consideration, that could happen. Yeah, it's all these things that it's a little bit like having a toddler. I'm going to make sure everything's toddler proof, and then they find that one thing that you didn't think of. It's likely that that's going to happen. There's going to be something we didn't think of, which is another reason why we want to go slowly, because you don't want to discover you forgot something and it's in the middle of a carefully orchestrated thing that now is going to fall apart because you were relying on it to work and it didn't. So
Yeah.
it's interesting. It's really interesting.
Do we have
Right, so,
any idea when we might move on to phase 2? Or are you thinking weeks and weeks away, or it could be any day, or?
The handling materials, so just not curbside, but prior to that, just getting staff in the library and stuff.
Yeah.
I would like to get the go-ahead from the town emergency management people, and they're actually working with town hall now, but I will be next. They had put me off for a long time, and then they realized other libraries were moving forward faster than they anticipated. They are a little bit shocked. I will say that the health people, at all the meetings I were at, the health people from the beginning were, me and the director of the senior center. They pretty much were saying, "Well, you should listen to this, but we'll get to you later because your operations are just too complicated and there are too many people at high risk in them. It's a high risk environment. You don't have to think about this yet." And then they realized that wasn't what was happening. And then the governor released it into his plan, and libraries turned up right onto offices. And it's like, it's nice that you're mentioning us, but obviously it's like nobody on that team knew what they were really saying, because there are a lot of boards. This board is very, very thoughtful. It's a nice mix of people. You're all in different positions and you do different things and see different things. There are plenty of boards that just want curbside pickup now, and they don't care how it happens. There are a couple of places that are doing it, and we were not supposed, the state said you're not supposed to be doing it. You're supposed to be home. And these libraries were working, and they were saying that they were essential. We are essential to people's lives in a certain way, but in a pandemic, essential it has a different meaning, and so no, we're not necessarily, but it's not it's gone to the local level. MBLC is not in charge of it. They can say that they will, put in their 2 cents. So far, they haven't. And that's mostly because they don't have the information yet either. They're waiting for more information. They're doing these studies. People will make up their mind about something, and within 24 hours, it all changes. It's all totally different. We didn't have to worry about children. Now we do. We didn't have to. What's interesting is I was in the high risk category, and I no longer am. They moved the age up to 65. They changed the weight requirement. They dropped off a couple of health things. Now you have to have diabetes, and I don't have that. So I'm actually no longer high risk. But 2 months ago, I was high risk. So I don't know. There's a lot we don't know yet. So we'll just move cautiously.
On the point of high risk, just thought of this. Are there any employees that could not return to work because of that?
That's one of the things. When Kevin was talking about the contract, I thought of that. Human Resources told me to be very careful to remember to ask about accommodations. Is there anyone who needs an accommodation? And I don't have to even know what that is. They only have to say that they need one. And the town is very generous about that. If you can, especially in our position, if you can do the job at home, we're going to accommodate that. So, and right now, 90% of the staff can. There's only a few things that have to do with administration, and now there's a few things that have to do with the computer and stuff. But for the most part, many of us can work at home. So.
And the plan would be to just keep those people working at home, even when you bring everybody else back.
Yeah, as many people as we can keep at home, I would really like to. there's different kinds of things that we can get done too when people are not interrupted at a desk. When you're working at a desk and somebody's coming up every 5 minutes, you're in the middle of a project and that project all gets broken up. These people are now, maybe they're being bothered by their pets and their children, but for the most part, they have this uninterrupted time. So the projects are a little bit different. We're catching up on some things that maybe we didn't do before. But yeah, there's always something to do. There's always something interesting.
Do we have employees who have indicated that they do not want to come back into the building?
No, but I have not asked it the question directly.
Okay.
But I have opened up regularly. I tell people, if you have any questions, if there's anything you need to say. So people have said stuff to me. One person was very anxious to get back to work and mentioned that. And actually I was a little concerned about that because I felt like that person didn't really take into consideration all of the safety precautions that they probably should take into consideration. So if anything, it's been the other problem, yeah.
Okay. Good.
Yeah, I think people are confident that the town is not pushing and that it will be done thoughtfully. Seems that way.
All right. Do you need a vote, Catherine, from us on the plan?
Yes, I would like one.
Okay. Does anyone else have any further discussion before we, can someone make a motion then to accept the proposed COVID-19 phase service plan? I think, Catherine, you had asked for some flexibility in that as well to allow for amendments to the plan in accordance with the town guidance and state guidance to that effect?
Yes.
Okay, someone want to make that motion?
I'll make that.
Cindy, second? Second, Laura, thank you. Any further discussion? Okay, we'll do a roll call vote. Chris?
Aye.
Laura?
Aye.
Susan?
Aye.
Amy?
Aye.
Cindy?
Aye.
Adam?
Aye.
Jeff? Tim?
Aye.
All right, well, that's unanimous. And you'll keep us up to date, Catherine, if there's any changes
Absolutely.
as we go along, because I know it's a very, speaking from my own experience, a very fluid situation and you can't anticipate a lot of things. And so if you think there's something that, if for some reason you think there needs to be an emergency meeting of some sort that you need to get the trustees together, just let us know as soon as you can. And then, we can either hop on a call or do it remotely like we need to.
Right, I'll do that. And I'm going to add it to the agenda as a regular agenda item, just so that we hit on it every month to make sure if there's any updates or whatever.
Okay. Any other business from the folks?
Good.
No, I just have it's not business, just a question. Given that we are the library and references and all that, is there any kind of like historian type documentation? Is anybody just kind of keeping track of this, once in 100 years event going on from a reference point, from a historian point? I'm thinking of like Jackie's PBS grant last year and sort of, what I mean? Like or is it something that, later on?
Is that what the stories project you guys are doing right now is basically?
Yeah.
We're trying.
That a lot of the problem we have, and probably all the trustees can really help with this, we have trouble getting our messages out. We just have trouble, and it's not just us. Every library has this problem, and every library, part of their strategic plan is to get better at it. So where is Stories for Wakefield? Is that on the main page of the?
It should be rotating through the main page.
So it's on the
been
website.
on social media.
And did I put it in the daily item?
Yes.
Yeah.
It was its own press release.
Yeah. So the point of the story, Amy, is that we have asked, we've encouraged the public to send us their pandemic story, and we will add it to the digital archive.
Okay.
So does Wakefield have their own section, and then Massachusetts has a section, and
It's the Digital Commonwealth, so it's Massachusetts,
Commonwealth.
the overarching, and then we have our own
and
page.
is Digital Commonwealth also part of
Digital Heritage.
Digital Heritage? So it's not the Internet Archive, or is it?
No.
No, those are two different things. Okay, I get confused.
Did,
It's an
Catherine,
archive.
have you asked Doug Lyons to include any of the library stuff in his, because he sends out pretty regular emails to almost every family in town.
Yeah, I don't know what he's sending out now. I've had a couple of communications with him. I think they're really, really up against it. So I will try again probably. Or, you know what I should do? Ooh, Jackie, I should give this to Nancy Sheehan and see if she can get it in through her people. Sometimes it's better if you go through another level. The administrative level, for instance, I'll send an email and it will have 3 questions on it, and one of them will get answered because there's just so much going on over there right now. We're just not top of the list.
Yeah, no, I think to just looking into, and I think you're probably right, getting through the teachers and through the principals might be a better, but especially as we get into summer, being able to push out the library resources for summer reading and things like that.
Oh, yeah.
I think that, I mean, that's the best reach. But yeah, I know is there a way through Noble to like do this is probably a reverse 911, like push out to everybody?
No.
Because if your email's in the system to get set up,
you really kind of have to opt in, and that's a library kind of, a librarian will say that they have to opt in. We're not sending anything. Privacy is very important, and not invading people's privacy and all of that is important. So we shoot more toward opting in. One of the ideas that we have been playing around with is sending a postcard to every home in Wakefield. And if we could get the right language on it, and it wasn't overwhelming, that might be a place where we could get people to connect in a way that works for them. You know, we have a weekly newsletter, an e-newsletter. We have a website. It needs to be updated, but we have a website. Upgraded, not updated. And we use the Daily Item and WCAT. We know people there. We have our own YouTube channel, and we have people working on this, all the social media, and we have people working on all these places, and yet there's still huge segments of the population who have no idea what's going on, that we're doing these things. Number one, it's not important to your daily life. It's extra information. And there's a lot of information out and around that's in everybody's airwaves. So it's something we're going to have to work on.
I think the postcard would be a great idea.
It would be.
Just for the digital resources and everything.
Especially right now, because people aren't mailing as much. Speaking as someone who is in marketing, does mailing, like I don't know if you've all noticed that you're getting less mail right now.
Yeah,
I noticed.
Not spending that money. So like, I think if something comes in the mail and it looks interesting, like, what is this? So it could be a sweet spot.
Yeah.
That's pretty short. I mean, it won't be cheap, but it wouldn't be that expensive to do, right?
No, I think we can actually manage it now because we haven't had any other postage expenses this year. So it's looking like it might be manageable, which is part of the reason I thought of it. Okay.
All right. Anything else from anybody?
Good.
No. All right. Are we moving the meeting for the June meeting, or no? We're keeping it at the same time, just moving the posting of the agenda.
I'm going to
earlier?
post it sooner.
Okay.
Yeah.
All right. That sounds good. If there's nothing else, I'll take a motion to adjourn.
I'll make a motion to adjourn.
All right. Second.
Second.
Okay. Cindy, Amy. All right. Roll call on that. Chris.
Aye.
Laura.
Aye.
Susan,
Yes.
Amy,
Yes.
Cindy,
Yes.
Adam,
Yes.
Jeff,
Yes.
Tim.
Aye.
All right. Unanimous. Thank you all very much, and we'll see you next month. And if there's anything, Catherine, that you need from us, just give us a shout. And
I will.
thanks very much for all your good work on this, and good luck with everything. If there's anything else you need, let us know.
Thank
Yeah,
you.
thank you guys.
Stay safe.
Appreciate
Thank
it.
you very much.
Great.